My name is Chris Gale, and I'm a third year exercise science student at Charles Sturt University. The presentation I am completing today is based on the roles and benefits of exercise in the management and/or prevention of chronic disease. Throughout my presentation, I will define what a chronic disease is and the different types of chronic diseases currently affecting today's society. I will also define the term exercise and explain the role it can play in either prevention and/or management of such chronic conditions. A study conducted by Deering et al. Defined chronic disease as a condition that is generally incurable, however, can be managed with the use of diet, exercise, and relevant medication to the disease. It was also stated that a chronic condition must be evident for a prolonged period of 3 or more months. There are many different forms of chronic diseases. They range in a wide range of severities. So chronic conditions may include such diseases as asthma, diabetes, stroke, CVD, and mental health disorders such as depression and anxiety, to name a few. It also should be stated that chronic conditions such as heart attack and stroke can cause death almost immediately. The graph evident in my slide shows the amount of people that have suffered a disability from the stated chronic disease. These stats were a result of the National Health Survey produced from the Australian Government for 2011 to 2012. Currently, the Australian Bureau of Statistics state that around 7 million people suffer from at least one chronic disease. Nyman defines exercise as any planned, structured, and repetitive bodily action performed to gain an increase in or maintain physical fitness. So inactivity has been shown to be a risk factor in a wide variety of chronic diseases such as metabolic conditions like diabetes, CVD conditions such as heart attack and stroke, pulmonary conditions including COPD and asthma, while also affecting reduced quality of life with diseases such as depression and anxiety. So the first chronic disease I will discuss is diabetes. Diabetes is a chronic disease characterized by high blood glucose. So blood sugar levels are controlled by insulin, which is produced via the pancreas. Diabetes occurs when one's body is unable to produce the needed amount of insulin, when the body becomes resistant to insulin, or both. Diabetes is characterized into three major groups. So type 1 diabetes is insulin dependent and predominantly diagnosed as a child or in early adulthood. Type 2 diabetes is mainly associated with lifestyle factors such as poor diet, insufficient exercise, which then increases the risk of being obese. Being obese is a major risk factor for type 2 diabetes. Type 2 diabetes, however, can be managed through a change of diet and increased amount of exercise. It may also involve the use of medications such as insulin injections to control blood sugar levels. Research suggests that around 85% of all diabetics suffer from type 2 diabetes. Gestational diabetes is only evident within pregnant women. It is predominantly cured after the birth of the child. So Roberts and Bernard state that lower fitness levels increase the risk of diabetes. So an increased participation of exercise has been suggested to be an important role in weight loss and weight loss management. Decreased body weight appears to be critical in the development of diabetes. It also reduces blood pressure, and this is exercise is also beneficial as it is able to improve the quality of life for a type 2 diabetic. So high levels of physical activity and or exercise were also associated with reduced risk of developing type 2 diabetes, mostly due to the weight loss and improved cardiorespiratory fitness. So Segal Yeah, he stated that the overall health was a major factor in the reduced risk. So aerobic exercise also appears to improve glycemic control and may also lead to a reduction in diabetes medication. So glycemic control is the medical term for controlling of blood sugar levels. So what the research suggested was with improved exercise adherence, glycemic control was also improved, and then the sufferer is less likely to have to take ongoing insulin injections to control their blood sugar. Secondly, I'll talk about stroke. So, a stroke is a form of cardiovascular disease that affects blood vessels supplying oxygen to the brain. Stroke is the second leading cause of death and a major cause of disability within Australia. And research has suggested that a decreased level of physical activity and exercise is also a major risk factor for stroke. So the graph below states that the type of disability both males and females have acquired as a result of a stroke. Physical activities refer to actions such as walking and everyday lifestyle activities. We can see that this is majorly affected in both males and females. So, research by Mako et al. It suggested that 3 months of treadmill training improved leg strength and floor walking performance. It also reduced hamstring spasticity and the energy cost of hemiparetic gait, suggesting that improved gross motor efficiency. So, this also improved the patient's ability to complete active activities of daily living, and as we've seen before, stroke has a major impact on that. Moderate to high active individuals have a decreased risk of suffering from both ischemic and hemorrhagic strokes by 20 and 27% respectively, compared to that of somebody that lives a sedentary lifestyle. Hypertension is a risk factor for both ischemic and hemorrhagic strokes, and therefore there is a direct response relationship between blood pressure and increased risk of stroke. So increased exercise lowers one's blood pressure, which is also a major contributor to lowering their risk of a stroke. It also states from Studensky et al. That completing an exercise program accelerates the improvements of quality of life in stroke patients. So it also is evident that they're able to get their independence back upon completion of the intervention a lot quicker than if they were not to take up any exercise. Chronic obstructive pulmonary disease is often referred to as COPD. It is a chronic disease characterized by airflow restriction that cannot be completely cured. The airflow limitation is usually both progressive and associated with an abnormal inflammatory response of the lungs to harmful particles or gases, such as smoking. So comorbidities such as chronic bronchitis and emphysema and asthma contribute to the severity in each sufferer. So chronic bronchitis is a clinical diagnosis for individuals suffering from a chronic cough most days for a period of 3 months in 2 consecutive years. An anatomical diagnosis of emphysema was made evident through abnormal permanent enlargement of the respiratory bronchioles and alveoli. So although there's no direct evidence suggesting exercise improves COPD, exercise does improve an individual's quality of life. It increases their physical fitness, while also it has been suggested that it decreases the severity of symptoms associated with COPD, including shortness of breath during exercise, wheezing, chest tightness. Exercise also reduces the severity of the chronic cough that's evident in chronic bronchitis. But it also must be mentioned that any benefits acquired through an exercise program will be lost unless exercise is continued on a regular basis. So mental health can be defined as the ability of individuals and groups to interact with one another and the environment in ways that promote personal well-being, optimal development, and the use of cognitive, affective, and relational abilities. Depression has been characterized by various processes such as withdrawal, sedentariness, and a sense of incompetence or loss of control. So with exercise, it has been hypothesized that with an increase of exercise, it increases in the availability of brain neurotransmitters such as serotonin, dopamine, and norepinephrine. These are all diminished when suffering depression. So, although researchers indicated a decrease in the severity of symptoms, there is no evidence to suggest that exercise prevents depression. But as we can see by Paluska, an increased aerobic and strength training has been been shown to reduce the symptoms of depression. So it appears to be as effective as other therapeutic modalities for depression of mild or moderate depressive symptoms. So rumination thoughts are decreased through participation in an exercise program, which in turn decreases the sense of negativity. So rumination style indicates an individual to predominantly focus on negative feelings about any given task. And this is thought to have a negative effect on the course of depression and contribute to one state of depression. However, with the completion of an exercise program, it is thought that the sense of achievement of exercise is able to distract the individual to a certain extent from the negative thoughts and celebrate what they are actually achieving in completing their exercise program. So in conclusion, from the research, it has suggested there is a profound relationship between increased exercise and a decreased risk of obtaining any of these chronic diseases. Exercise seemed to be an excellent management tool for individuals suffering from many chronic diseases currently affecting our society, as the ones that I've mentioned in my presentation. An increase in exercise also reduced many risk factors associated with chronic conditions, such as obesity being a risk factor for type 2 diabetes. And overall, exercise improves the quality of life for not only just the chronic disease sufferers, but also the general population.